So even as the world adapts to the new normal of wearing face masks, Centers for Disease Control globally maintain that children below the age of 2 should not wear masks or anything that covers their faces. Why, you may ask? And how can you protect your infant or toddler from infections? Dr. Swangira explains.
Children are not small adults. Their bodies' respiratory and immune systems do not respond the same way adults' bodies do. In Kenya, as is all over the world, infants aged 2 and below have tested positive for COVID-19. For example, on May 10th, a 1-year 9-month-old child tested positive. On May 8th, an 11-month-old. On May 5th, a 2-year-old. And on April 30th, a 1.5-month-old infant were also confirmed cases. But despite this increase in the number of cases, medics do not recommend masks for infants. But this is scaring to many parents, as demonstrated by this mother in Kawangware, who worries about her toddler.
Mtoto wako hana mask.
Ndio swali na wauliza, huyu anafaa kufunikwa mapua.
WHO, CDC, and pediatric associations guidelines do not recommend masks for children below the age of 2. They should not wear masks or anything that covers their face. Dr. Anne-Marie Masharia, an infectious disease specialist treating children at the Kenyatta National Hospital, explains that babies' airways are smaller and they do not process carbon dioxide the way adults do. Therefore, rebreathing behind the mask is dangerous.
All the kids who have positive, it's because there's a positive adult contact in the house. The risk of children transmitting is minimal, yeah? And especially if they're sick, and then you put that mask on their face, you can actually suffocate that baby. Skin is already compromised, and then you make it even more difficult by putting a surgical mask on them.
If they are struggling to breathe, infants are unable to take the mask off themselves and they could suffocate. Older infants or young toddlers are not likely to keep the masks on, and they will likely try to remove it as well as touch their face, more often due to the masks annoying them, further exposing them to the virus. Another important question is how we can protect infants and toddlers who cannot wear masks.
Social distancing, nurse these children well spaced from other children, and then issue their caregivers who are likely then to be the closest contact with a mask. Unless they're really going to hospital, so I'd minimize movement with them. I've seen a lot of parents taking young children into the supermarket. So for children, minimize their leaving the home. If they must leave the home, maintain social distance of up to 2 meters from other people, wherever it is that you're going. And then for you, you wear a mask. And before you touch or handle your baby, make sure you clean your hands well.
If one must go to public spaces with an infant or toddler, the outings must be as short as possible. Any covering, if the baby is in a pram or baby carrier, must be light and breathable. Children must never be left unattended. For children of between ages 3 to 6, wearing a mask may still be tricky, experts say. Parents are therefore encouraged to use their best judgment. Dorcas Swangira, Citizen TV, Nairobi.